Good afternoon. My name is Eric Mills, and today we're going to be looking at a PowerPoint presentation about multiple sclerosis. I do apologize that I am having some visual difficulties with the Screenotastic app on my computer, so therefore some of the PowerPoint may be cut off, but we will get through the information, and I will also have an attachment of the PowerPoint in my submission. So first, about MS, it's commonly known to be an autoimmune disease that attacks the nervous system that leads to the whole body. It's been reported that as many as 400,000 to about 500,000 people in the United States alone have been diagnosed with MS, and that hundreds more are diagnosed every week. Some more basic information about multiple sclerosis is that the word sclerosis is a Greek word meaning hardening of tissue or scars. MS is not contagious, and diagnosis of MS is usually between 20 and 40 years of age. Among young adults, MS is the most common disease of the central nervous system. Multiple sclerosis is not inherited or genetically transmitted, although there does seem to be some genetic susceptibility to the disease. MS does not significantly affect lifespan, and it's a progressive disease for which there is not yet a cure, unfortunately. Increased understanding of MS has led to the development, though, of many new treatments that target both the disease process and its many symptoms. A few facets about MS. There are 4 types of MS: relapsing, remitting, secondary progressive, primary progressive, and progressive relapsing. About 85% of those who are newly diagnosed have the relapsing remitting form of MS, and the course of the disease is unpredictable, and no two people will experience the same set of symptoms, which we'll see later on in the presentation. And we'll continue forward from here. Some of the causes of MS. The complete cause of multiple sclerosis is unknown, unfortunately, so there really isn't a full known cause. However, there has been a lot of research that has been done into the possibility of what could be some of those possible causes. We do know that it is caused by nerve damage that's occurring to the myelin sheath, which is sort of like the protective covering of the nerves in our body, the nervous system. Studies have been done to support the belief of possible immunological factors, genetic factors, as well as infectious factors. Something interesting about the 4 types of MS. To give you a little more information about them, the relapsing remitting MS is the most common form of multiple sclerosis, and about 85% of people with MS are initially diagnosed with RRMS, which is the relapsing remitting. People with the relapsing remitting have temporary periods called relapses, flare-ups, or exacerbations when new symptoms appear. There's also secondary progressive MS, which is when symptoms worsen more steadily over time with or without the occurrence of relapses and remissions. Most people who are diagnosed with the RRMS will transition to the secondary progressive at some point. Then there's the primary progressive MS, and this type is not very common, meaning that it occurs in about maybe 10% of people with MS. The primary progressive is characterized by slowly worsening symptoms from the beginning with no relapses or remissions. And then there's the progressive relapsing MS, which is the most rare form of MS, meaning that about 5% of people have this. And it's characterized by a steadily worsening disease state from the beginning with acute relapses but no remissions with or without recovery. So basically, it's almost like a gradual continuation of it just worsening over time. Some things about MS treatments. There are many treatments today that further assist in slowing down the disease's progression and helping to ease the symptoms caused by MS. Scientists have found encouragement through advancements in diagnosis of MS using magnetic resonance imaging or MRI brain scans. And there is no cure for multiple sclerosis, as said before, but there are many different treatments, including steroidal drugs that can attack the disease. Some of the more common ones that are known, and you'll have to forgive me if I say them incorrectly, but some of them that I was researching and looking up was beta interferons are injectable medications used for treatment of relapsing or remitting MS, and certain beta interferon products may also be used for first clinical episode with MRI findings that are consistent with MS. Depending on the medication, injections for beta interferons can be either subcutaneous or intramuscular, and dosing can vary from every other day to once a week. Some more common medications are the glatiramer acetate, which is given by subcutaneous injection every day for the treatment of relapsing or remitting MS. It's also used for patients who have experienced a first clinical episode and have MRI findings consistent with MS. Some more common ones like this are fingolimod. It's a once daily oral capsule indicated for the treatment of relapsing forms to reduce the frequency of clinical exacerbations and to delay the accumulation of physical disability. Another one is called teriflunomide. It's a once daily oral tablet used for the treatment of patients with relapsing forms of multiple sclerosis. Another interesting form of medication that I came across was mitoxantrone, and it's a chemotherapeutic agent for the treatment of worsening relapsing remitting MS, progressive relapsing MS, or the secondary progressive MS. And it's used to reduce the neurologic disability and the frequency of clinical exacerbations. It tends to be administered intravenously by an infusion once every 3 months. So those are some more of the common medicines that are known about. Some of the consequences or the symptoms that tend to come along with MS involve living with very weak immune systems most of the time. Usually they feel a lot of fatigue. The body is very weak most of the time, very tired, and frequent to becoming sick due to that low immune system. Something else that's very common is depression. It tends to become another common consequence as well. So some more information that I've come across is some things like the importance of early treatment. If you're diagnosed with MS or a first-time MS event, you should definitely consider talking about starting treatment as soon as possible with your healthcare team. Researchers have found that MS often causes more damage in the first year than in the later years. Some treatment options. There's various MS treatment options available today that have been shown to decrease the frequency of relapses and to delay disease progression. There are several ways that these treatment options can be taken, however. So some treatments can use an injection, either subcutaneous, under the skin, or intramuscular, where it goes right into the muscle. And some are given intravenously, such as infusion or orally by mouth. And this is basically going to come to the end of this presentation. As you can see here, I have given some of my references that I found, as well as the Multiple Sclerosis Foundation and the McGill's Medical Guide online that I used to find research and information on this. I hope that you have found some useful information from this presentation, and I always encourage people to go out and to be aware of different diseases out there and to spread awareness and how we can find cures for these. Thank you very much, and have a great day.